shoes and out the door. 5, I'm alive. 6, 7, 8, feeling great.
Hey everybody, welcome back to the Beyond Your Wildest Genes podcast. I'm your co-host today, Dr. Mike Akinfor, and today I have with me Dr. Peter Osborne. Peter, how are you?
I'm doing great, Michael. How are you doing?
I'm doing fantastic. I'm going to read you Dr. Peter's bio, and we'll get right into his new book, No Grain, No Pain, a 30-day diet for eliminating chronic pain for life. So Dr. Peter Osborne is a clinical director of Origins Healthcare in Sugar Land, Texas. He's a Doctor of Pastoral Science, a board-certified in Chiropractic Medicine, and a Diplomate of American Clinical Board of Nutrition. In practice since 2001, Dr. Osborne's clinic focus is the holistic natural treatment of chronic degenerative diseases with a primary focus on gluten sensitivity and food allergies. He founded the Gluten Free Society in 2010 to help educate patients and physicians on the far-reaching effects of gluten sensitivity. He is the author of Glutenology, a series of digital videos and ebooks designed to help educate the world about gluten. He lives in Sugar Land, Texas. Dr. Peter, it's a pleasure to have you on today.
It's a pleasure to be here. Thanks for having me.
So could you introduce yourself to our audience and tell them about your journey?
Absolutely. I started a big part of my undergraduate and graduate training, with a passion in bodybuilding and nutrition. And the two were so hand in hand. I mean, you couldn't build big muscles or strong muscles or go further or run faster if you didn't have a good diet. But from there, it just kind of escalated. One of my experiences early on in graduate school was at the VA hospital. I worked in the rheumatology wing. And we were treating all these patients with autoimmune pain, rheumatoid arthritis and lupus and fibromyalgia and just a variety of different autoimmune diseases that were relatively, where we're being told they were incurable. Not only were we being told they were incurable, we were being told there's nothing you could really do about it other than try to manage their pain. And that, to me, was very frustrating. My attending physician was probably one of the most miserable people even today that I've ever met. He threw things at patients. He screamed at patients. He treated them, in my opinion, very disrespectfully. And I don't think he was necessarily a horrible doctor. I think he was just a very miserable person. I could imagine being in practice for 40 years and not getting anyone better. That to me was my wake-up call. So it led me to looking at autoimmune disease a little bit differently. I mean, when I started to investigate in the literature, in the medical literature, autoimmunity, the thing that kept popping up over and over again was celiac disease. And it was the only autoimmune disease we had a known cause for. And, and that was gluten sensitivity. And so I thought, well, why, if we know what causes this autoimmune condition, why don't we apply that to these other forms of autoimmune pain conditions? Why isn't anybody doing that? It just makes sense to me that that's the natural progressive next step. But the other thing I found, Michael, was that in the research, if you fasted people with autoimmune disease, they recovered. Their pain got better almost within 48 hours.
Wow.
And so to me, now that's step two. Okay, well, we know gluten can cause autoimmune disease in the form of celiac disease, and we know that fasting these patients can lead to a remission of their pain in 48 hours. Don't you think it's time to start thinking about diet? And I took this information, and again, this is information being published in major medical journals. We're not talking about Men's Health. We're not talking about editorial pieces. We're talking about major journals, the Journal of Rheumatology, etc. And I basically got laughed at and said, this is garbage. This is hocus pocus. We're not doing any nutrition. And all I was asking for was, let's take 10 patients and let's just give it a shot. Let's just do a little sidearm study here, in-house and just see what comes of it. But I was told not to pursue that. I was told to cease and desist. And that's when I left. I left the hospital and started my own practice. And one of my first patients in practice was a young girl with juvenile rheumatoid arthritis. She had a death sentence. They gave her 6 months to live. And her mom brought me in or brought her in to see me rather. And, we did some testing, found out she was gluten sensitive. Now, here's the kicker. Her mom did not want to take her gluten sensitive because her favorite food is pizza, right? So here I'm faced with this, okay, your child is dying, and here's how bad it was. The child, she had a permanent stent embedded in her arm. She was in and out of the hospital so frequently from an emergency perspective. The Make-A-Wish Foundation granted her wish.
Wow.
This is the diagnosis that we're dealing with. And I'm having a hard time convincing the mom to take her gluten-free. But the mom actually went gluten-free. She had rheumatoid arthritis. And within a month, her pain was so dramatically reduced that it was enough evidence for her at that point to take the pizza away. And so that was 15 years ago. Today, that young girl's in high school getting ready to graduate with no medication, stents out of her arm. She's got a full lease back on life. And that was one of my first run-ins with actual clinical, outcome result of changing the diet with a dire disease. And now from that perspective, and when I understood that, it was a very easy next step, because there's 46 million people in the U.S. with autoimmune disease. Many of those cases are life-threatening, just like this young girl's case was. And all of them are being misdirected and misguided. So I had to find a way to reach a broader audience, because in a clinic, as you know, giving good quality care, you can only see so many people a day, so many people a year. And I cap my practice because I don't want to be overwhelmed with cases and give less than stellar care. So for me, it was how do we take this message bigger? And that's where no grain, no pain came from. It came from those years of experience. It came from the medical evidence and research, and a desire to reach people who were in dire straits, who really needed a serious solution about how to treat pain to its resolution by arresting the origin of where the pain comes from versus medicating and masking the symptoms.
Wow. That is an incredible story, and you helped change that young girl's life, and you've changed the arc of that life. That is amazing. And you have such a bigger vision. I want to dive into your book now. So let's talk about the connection between grain, inflammation, and pain.
So there's this huge connection biochemically. I call it grainflammation. And what happens, there are a number of different things in grain beyond gluten. I think it's very important to point that out. So many people are gluten fixated. We've looked at gluten and we've demonized it to the point that I think people are probably even tired of hearing about it. It's not just gluten. Let me just preface this whole thing by saying it's not just gluten. Grain itself, yes, contains gluten, but grain also contains heavy quantities of pesticides that mimic estrogens and alter hormones and cause people to gain weight. Grain also contains molds and mycotoxins, which can be very toxic to humans and trigger autoimmune processes. Grain contains other classes of proteins that can shut down human digestion, preventing us from being able to process and break it down. Grain contains elements that can trigger leaky gut, breaking holes open in our intestines, allowing foods and bacteria and other proteins to leak into our bloodstream and overstimulate our immune system to chronically produce inflammation. So those are just examples of how grain as a food can induce or can trigger or can contribute to an inflammatory burden on our bodies that make it easier for our bodies to stay in a state of chronic pain. Remember, chronic pain comes from a root source of inflammation. So that being said, we have to reverse engineer where that inflammation comes from. And it can come from food, it can come from infection, it can come from exposure to environmental toxins, it can come from poor behavior, it can come from lack of sleep, it can come from lack of sunshine. So there's all these different reasons, but grain is one of those that it's a major reason why people have chronic elevated levels of inflammatory chemicals, because their immune systems are busy attacking the diet. And the premise of eating is that food should provide nourishment to allow the body to heal and repair and maintain. But if the food that we're eating is providing detriment and creating inflammation and overburdening our immune system and creating leaky gut, then that's the opposite of the intention of eating. And we have so many people that are so fixated on grain as a staple food in their diet. They eat cereal for breakfast. The milk in the cereal comes from cows that are fed only grain. They eat a sandwich for lunch, and the meat is from cows or from animals that are fed only grain, and the bread is from grain. And the mayonnaise is basically got all different kinds of vegetable oil, usually soy or corn oil, which is grain. Then we have, dinner, which is some form of meat-fed grain plus pasta which is grain, right? So, all those things being said, the staple of the diet in the U.S., 60% plus of the average person's diet is coming from one food group.
Wow.
And we have more disease today. We have more heart disease, more cancer, more autoimmune disease, and more chronic pain than we've ever had, despite all the medical intervention, despite the surgeries and the medications. We have more disease, not less. It tells us our system isn't working, and we have to go backwards 50 years, and we have to look at where the research left off before drugs, and that was nutrition, and that was diet. And we have to start analyzing what we're putting in our mouth. Input equals output. And so as it relates to grain, I know I said a lot in that last few minutes, but I think it's important to kind of give a broad overview for people to think about, what they're actually doing and what actually is going on.
Just to form a question with this is, you're actually saying that food can cause physical pain. Is that correct?
Absolutely.
So I want to dive in a little deeper on this gluten. And what you wrote was that a myth is that gluten is only found in wheat, barley, and rye, and sometimes oats. This is something as a practitioner that I am very familiar with, but could you share that with our audience, how many types of gluten there are? Because this is remarkable, and this is the first time people are going to hear this.
Yes, so the research dates back to 1940s, and the way we actually discovered gluten was really, it was a very, very smart physician. His name was William Dickey, and he was practicing as a pediatrician gastroenterologist in a hospital in Germany, and what he found was that during World War II, when grain was no longer available to the children in the hospital, and these were children with celiac disease, and again, going back in time, we didn't know what caused celiac disease in the 1940s. So this smart doctor found that when grain was no longer available to his patients, they all got better. And he made that first observation and published his paper in 1952. And from that publication, another study came out, and that study came out of the University of Alabama, Birmingham. And what they isolated in patients, 10 patients, the study was done on 10 people. Michael, as you know, a study on 10 people is not a conclusive study by any means, but the study was done on 10 people where the protein alpha-gliadin was isolated, and isolated as the cause of celiac disease in these 10 people. Now, alpha-gliadin is one kind of gluten. There's literally over 1,000 different forms of gluten. Alpha-gliadin is just one of them, and it's found primarily in wheat, barley, and rye. And so this is kind of the platform for what everybody thinks about gluten, is that it's only, really gluten is only alpha-gliadin, and it's only found in wheat, barley, and rye. But the reality is, corn has multiple kinds of gluten. Wheat all by itself has 400 different forms of gluten, different than alpha-gliadin. In 2010, a group of researchers from Australia isolated 400 new forms of gluten. 40 of them were more toxic than alpha-gliadin, discovered from 1952. So we're in the infancy of this research. And so people that gravitate toward this, traditional gluten-free diet of only cutting wheat, barley, and rye out, they're still getting glutens from other grains. They're just different kinds of gluten. And many of these people are reacting to these glutens. Corn, probably more notorious than any other. Corn in 2012, a study published found that the corn gluten interacts with the genetic receptors responsible for gluten sensitivity more aggressively than wheat gluten.
Wow.
And so corn, is oftentimes the food product that's used to make a gluten-free substitute food, the cornbreads, the corn pastas, So people are going gluten-free in this traditional sense. They're avoiding wheat, barley, and rye. And several follow-up studies have shown that up to 92% of these individuals have persistent inflammation and persistent problems.
Wow.
And to me, that's alarming, right? That's alarming because, here the gluten-free diet is so popular, and we have such an opportunity as doctors to educate and help people. But the message in the food industry has kind of hijacked this whole movement and said, eat all this other garbage food with other forms of grain in it, and you'll be fine.
Exactly.
And even the major research facilities across the U.S., one of the things they do when they make a diagnosis of celiac disease is they give these patients a gift basket full of highly processed, genetically modified garbage food and say, now you can eat this, right? And so they're giving these very chronically sick patients food that even if they weren't gluten sensitive, would be very unhealthy for them, and saying, eat this to recover from years of chronic detrimental disease. Input equals output. You can't put garbage in and expect good out, whether it's gluten-free or not. So part of the problem is that many of these quote-unquote supposed gluten-free grains just aren't healthy in the way that they're being packaged and processed. But the other aspect is that many of them contain glutens. Some of them are genetically modified and do damage in different ways. Rice is loaded with cadmium and arsenic, which are heavy toxic metals that can trigger all types of different hormonal disruption and problems in humans. And we're being told to eat these things en masse as a healthy substitute on a gluten-free diet. And so No Grain, No Pain is all about diving into the depths of why not to do those things and how better to position your diet so that you position yourself as an individual for success and reestablishing and restoring health.
Let's talk about how leaky gut and pain go hand in hand.
That's a great question. Leaky gut is coming. It's another one of these really, really big buzz phrases right now. The technical medical term is intestinal hyperpermeability. And leaky gut is actually a normal process in the gut. It's when leaky gut is there all the time. So the gut will become leaky transiently from time to time. And there's a premise and purpose. But it's when the gut is basically the floodgates are open and it's never closed. That's when that's what we'll call that leaky gut. What happens is the contents of the intestine are supposed to be vetted by the GI tract. There's 5 primary barriers in the GI tract whose design and function are to vet the contents of the gut lumen or the gut itself and say, okay, these are good guys and these are bad. Bad guys are going to go out in the poop, and the good guys they're going to be allowed in. We're going to let those guys in. We're going to absorb them into the bloodstream, and we're going to use those nutrients, those vitamins, minerals, carbs, fats, proteins, etc. But a leaky gut allows everything in. So you get, everything that's bad is now allowed from the lumen of the gut into the bloodstream. Now, right behind the gut lumen, in other words, right behind the gut wall, 75% of our entire immune system is concentrated right there. And it's there for a reason. It's there to protect us in case this leak occurs. And so that tissue is called the GALT, the gastro-associated lymphoid tissue. It's like tonsils that wrap around the small intestine. And it's full of white blood cells that are there to defend you from things that might leak in and pose a potential threat to your health. But now imagine that the gut, there's a hole in the gut and it's wide open and things are just leaking in all the time. And so think of this immune tissue as soldiers. And soldiers who are at war, who never get a break, who never get rest, who constantly battle day in and day out, their nerves become shot. They develop post-traumatic stress disorder. And instead of being able to intelligently analyze and assess a situation, they're just shooting everything. Anything that comes through, they're shooting it, right? So imagine your sentry cells in your gut, behind your gut wall, are so busy attacking all the time because there's all these leaks in your gut that they become overreactive. And this is autoimmune disease. When those cells become overreactive, they now start to turn inward and attack your own tissue. And some of the most notorious tissues that get attacked are our joints and muscles. Now, so one, we can get an overreactive immune system, which can attack our own tissue. But two, some of these proteins that are leaking in from the gut can actually mimic our body's tissues. So some of these proteins might actually look like a person's thyroid gland or thyroid hormone. Some of these proteins leaking through might look like your cartilage or your muscle. So your immune system, which has been on for so long and has been attacking these tissues, or rather these chemicals leaking in for so long, now it starts to look inward and it starts to say, hey, you know what? The thyroid, we've been attacking this chemical, and this chemical looks like the thyroid. And so it says, hey, the thyroid's a bad guy too. And now it starts sending immune cells over to attack the thyroid. And so then we get chronic pain as a result of this. And pain, a lot of people think of pain and they think of physical pain, like, ouch, my elbow hurts or my knee hurts. Chronic pain can be systemic. In other words, there is a pain associated with hypothyroidism because when your metabolism and your thyroid hormone doesn't work, your muscles go into cramping and spasming, and they don't get enough oxygen, and their metabolism slows down, and they're more prone to injury. And so you develop pain as a result of hormone disruption. You can also have direct joint pain because your immune system will attack your cartilage and your muscles. So there will be direct inflammation and direct damage that's occurring within your joint or muscle or ligament or tendon, etc. You can also develop, damage or attacking. This process can damage and affect the liver. And now the liver doesn't have the capacity to detox. And so all these extra chemicals that the liver, a healthy liver would detox, stay in your blood and float around in your blood, and they're doing their own damage. And so it just creates this cascade of events that leads to just a severe state of chronic inflammation, heightened pain in many different forms.
It really hit home for me when my wife, who is the light of my life, she's a cancer survivor, and I had started down this road to no grains about 8 years ago. She's like, no, I don't want to give it up. I don't want to give it up. And then she went for a checkup, and she had thyroid issues. So I said, okay, it's time. And in 6 weeks, all the numbers were back to normal. 6 weeks, completely back to normal. No gluten, living a real food lifestyle. Amazing, just amazing.
Yeah, the body heals. You just have to take away what's doing the damage. It's a great story.
It really is. So getting back to this one topic that I want to hit before we go. When I was in the gym and training really hard, and even for myself, I couldn't figure out why I had this chronic rotator cuff problem and why I continued to gain weight. Could you talk a little bit about why that was happening, like the weight gain, grain consumption, and inflammation?
Yeah, so one of the, there's another term I like to use is grain-becity. The fastest way to fatten up a farm animal is feed them grain. And this is why we do grain finishing. It's to marbleize the meat because marbleized meat is sweeter than grass-fed beef. But it's also to increase the weight so that we can make and earn a greater quantity of dollars when we go to sell the animal. We sell them, the farmers sell the animal by weight. And so the grain finishing causes the animals to become obese. And it's not much different with humans. And one of the reasons why is that an excessive carbohydrate load. So part of the grain issue is that the sugars and the carbohydrate load that you're getting when you're eating aggressive quantities of grain can trigger changes in the hormones cortisol and insulin. And these changes actually turn on fat storage. And so then it becomes a very, very challenging thing to lose weight or to maintain a healthy body weight when those hormones are disrupted to that degree. Because it doesn't matter. I mean, it becomes a non-issue with calories. In other words, it's not about the calories that you eat. It's not about energy in equals energy out. It's about hormonal changes telling your body to store everything that you eat, no matter what it is. And so you're storing all this extra fat around your organs and extra fat around your abdomen. And that leads to weight gain and obesity and chronic. That kind of fat is what we would also coin as angry fat. It's very highly inflammatory because the type of chemicals coming in the body with that type of food are highly inflammatory, and your body, as part of trying to get rid of those chemicals, just packs it into fat cells. And then so you take that weight gain and you put all that added pressure and stress on your joints. Now go to the gym. Your body's chronically inflamed. Your hormones are imbalanced. You've got more weight on you on your frame, and it's an overburden on your frame. And now you want to add weightlifting to that, and it's a recipe for injury.
Sure.
It's a recipe for not being able to recover from an injury if you already have an injury. And so this is most likely where you could tell me better than I could with your experience, but it's most likely probably where you were in that situation.
We came from the 1990s of high carb, low fat, and it just fed right into this chronic rotator cuff problem. And literally within a month, when I went to eating real food and grain free, the problem cleared up after 30 years, which is just remarkable. So what our audiences would really be interested in is so if they are overweight and they do have this chronic joint pain, what exercise would you recommend for someone?
Depending on how overweight they are and depending on how much pain they're in, There's a lot of different ways to approach exercise. I'm a big fan of high intensity interval training if a patient can tolerate it, but many patients are in such pain and are so overweight that it's really not an option for them.
Sure.
So pull work is a great place to start because we can get a lot of motion and movement. We can get a lot of lubrication to joints in a simulated zero gravity environment. But I like to get people out of the pool as quickly as possible. So we like to go from the pool and graduate them to other low weight bearing activity. And one of the things that works really well is a vibration platform. So doing different kinds of exercises on a whole body vibration platform creates less jar on the joints. So if they're in a lot of pain, this is an exercise platform that's very easy to tolerate. And then as we're changing their diet and addressing their nutrition and the weight is coming off and the stress and the pressure on the joints is reduced, now they can take up exercise in a real and more meaningful way, and that is body weight calisthenics. I think probably one of the best forms of exercise that gets overlooked by most people. A lot of people want to lift weights, but lifting your own body weight, being a master of your own body weight is probably one of the most important things you could accomplish. So, basic exercises like pull-ups and sit-ups and squats and lunges and jump ropes and sprinting. The old thing of it as the way the old boxers used to train. They were lean and mean and very well muscled because of the way they trained, because they used their body weight as the tool and they didn't overdo it. And that's what I would say. Exercise is critical and important. It's important to build muscle, but it's also important not to overdo it, especially if you're coming from the place of being chronically ill, because you don't want to put your body in the position that it has to decide, one, whether it's going to heal you from your workout or heal you from your chronic disease. You want a nice balance. And if you work out too aggressively, then your body has to decide. And your body, it'll just take you longer to recover if you do that.
And that's really hits home for people that have these chronic joint pain. You've used two terms that I've never heard before, and I love them: grainflammation and grain-becity. Did you coin those terms yourself?
I did.
That's awesome. I love it. And I think it describes the issue perfectly. You've written a great book. I am thrilled to have you on our show today. Could you tell our audience where they can find you?
Yeah, we've got a lot of different outreach online. If they're interested in the book, nograinnopainbook.com. Right now, we're giving away some really great bonuses if people pick up a copy of the book. We've got a 60-page leaky gut manual that we're giving to them, as well as an extra set of recipes and a number of other coupons and things. If they want to just learn more about the medical aspect and get more of the science, all the references are in the back of the book, but I also have a foundation. It's glutenfreesociety.org, and there are thousands of pages of information on that website, and it's there. People can go through it. There's videos, there's references to medical research, there's lists of what not to eat versus what to eat, etc. It can be very helpful for somebody if they're just getting started. And then, of course, we've got our clinic as well, which is, you can find me there at Dr. Peter Osborne, OSBORNE.com, drpeterosborne.com. And that website has a lot of information on it as well, but it's a link to our clinic here in Houston, Texas.
Brilliant. And we will have these in the show notes going forward as well. And we will be sending out the link for the book. I think it's a must-read book. I think that it will greatly enhance, and having myself gone through this, enhance the quality of life. So, Doc, it's great having you on the show. It was my pleasure. The time just flew by. Any last words that you want to impart on our community?
I would just say this: if you're suffering with chronic pain, don't sell yourself short. There is a better answer. There is a better life waiting for you. You're not here on this earth to be sick and to hurt all the time. If you're a skeptic, just try it out. Do a test drive. Do 30 days grain-free. 30 days grain-free. And if you don't notice a difference, let me just put it like this. I've never not seen someone notice a difference in 30 days. That's how powerful it is. So give it a test drive and you'll change your life.
I love it. I love it. Thanks again, Dr. Osborne, for being on the show. Folks, if you like the show, please go to iTunes and subscribe, as well as write a review. Give us a couple stars. Let us know what you think. And we will talk to you soon. Thanks, everybody. Have a great day. Ciao.